Now, I don't work at a carnival, but if I had to guess one of the top questions that's on your mind right now about retiring to Southeast Tennessee, got to be about healthcare. Because really, if the doctors aren't good, the low taxes, they're not going to matter. And I get it because I had to answer that question for myself when I first moved here. And I've been navigating this region's healthcare system ever since, including a decade of managing Lyme disease that's taken me to more specialists than I'd care to count. So today, we're going to walk through the major hospital systems that are serving this region, what the VA situation is going to look like for veterans, how to think about specialist access, and one alternative approach to primary care that I personally use that most people relocating here haven't heard of yet, all so that you can have a clearer picture of what to expect before you make your move. And I want to start with something that actually surprised me. Before my first appointment with my endocrinologist in Chattanooga, I got a heads up. The intake nurse said on the phone, "Your appointment says 9:30, but don't expect to go back for at least 30 minutes after that." He loves listening to his patients and he asks a lot of questions, so his appointments tend to run a little long. And I thought, God, I love that. These days, it can be kind of tough to find a doctor that will spend more than 5 minutes with you. And this doctor wasn't asking me about the weather. He wasn't asking me about what TV shows I was watching. He was asking real questions about what was going on with my health, connecting the dots, and was genuinely curious. That experience, it set the tone for how I think about healthcare in this whole region. And it's the opposite of what most people fear when they picture leaving a major metro behind. I'm Chris Roberts, your Southeast Tennessee relocation realtor. And if you've got any questions at all after this video, just call or text me anytime at the number that you're going to see right here on the screen in front of you and download my relocation guide that's going to be linked right below. All right, first, a quick geography reset because it's going to matter for healthcare. Southeast Tennessee is a decent sized region, and depending on where you land, be it Cleveland, Athens, Etowah, Charleston, Ringgold, your distance to major medical care is going to be different. The two biggest hospital systems in this region are Erlanger Health System and CHI Memorial, both in Chattanooga. Erlanger is the level 1 trauma center for this whole region. It's the top of the chain when things get serious. I've personally had procedures at both Erlanger and CHI, and every experience has been on time, professional, and personable. Everyone's always super duper nice. These are not small community hospitals. These are full service major medical systems. And for a lot of the areas that we talk about on this channel, Cleveland, Athens, and the smaller towns that are north of Chattanooga, you're looking at 30 to 45 minutes to either of those systems. That's not nothing, but it's also not the end of the world, and it's a number that's worth knowing. All right, before I go any further, if you're seriously researching a retirement move to this region and you want to walk through your specific situation, my number is going to be right here on your screen. I do these kinds of calls every week. All right, back to the hospitals. Now, here's part of the conversation that I want to be honest about because it's something that some of my clients have heard through the grapevine and wondered about. For a while, the hospitals serving Cleveland and Bradley County had a tough run. It went through several ownership changes under a large for profit system, and the community felt that. The care did suffer a bit, and the integration with the community, the investment in the long term, didn't always feel stable. That changed in 2024. A not for profit system called Vitruvian Health, formerly Hamilton Healthcare System out of Dalton, Georgia, acquired what was then Tennova Healthcare Cleveland for $160 million and renamed it Bradley Medical Center. And what's meaningful about that isn't just the name change. It's that a not for profit, community minded system made a deliberate decision to invest in this region. Their stated goal is better integration with the community, expanded services, and long term stability. That's the right direction. And as a 351 bed hospital serving all of Bradley County, it's a real functioning local resource, not just urgent care. So if you're relocating to Tennessee and you want to understand a community's healthcare trajectory, not just its current snapshot, look at who owns the hospital systems and whether they're in it for the community or in it for the quarterly earnings report. This ownership shift at Bradley Medical Center really matters. And now, if you're looking at Athens or any of the McMinn County towns, Etowah, Nyota, Englewood, or even Riceville, the anchor is going to be Starr Regional Medical Center. My wife Megan works there as a PRN therapist, and before that, she managed outpatient physical therapy clinics in the area where she worked with a lot of retirees. And her mom was an ER nurse at Erlanger in Chattanooga, the region's flagship trauma center. So our family definitely has some boots on the ground experience here in healthcare. Megan's perspective from Starr is that it's a real community hospital, the kind where staff actually know their patients and it covers the essentials and handles a wide range of care. They even just opened up a brand new ICU that doubled their capacity for critical care. And for things that may be more complex, Erlanger and CHI in Chattanooga, they're just about 45 minutes south. And one thing that Megan is always quick to say, having come from a background connected to Grady Hospital in Atlanta, where the ER sounds more like an episode of The Pit, is that the ER wait times here are not like what they are on TV. While you might wait a little and time always moves slower when you're hurting, the scale of what you're walking into is very different from a major metro. Now, the trade off in a smaller regional hospital isn't necessarily quality, it's going to be the depth of specialists. Star Regional handles primary care, urgent needs, and a solid range of services. For subspecialty care, you'll be driving to Chattanooga or even up to Knoxville. That's a real consideration for retirement planning, and I'd rather you know now than have you discover it later. All right, let me talk about specialists for a second because I have actual experience here. I've been managing Lyme disease for about a decade now. That means regular specialist visits, periodic procedures, labs, follow ups. I've seen doctors at Erlanger, CHI, Emory in Atlanta, and more. So I've been through the whole process of finding specialty care in a region that isn't a major metro. And here's what I've found. The specialists exist. The access is there, but sometimes it just takes a little bit more intentionality than it would in a city like Atlanta or Chicago, where specialist offices are as common as a Starbucks. You may need to drive to Chattanooga. You may need to get on a wait list. And you may need to coordinate across systems in a way that requires just a little bit more patience. It's not a deal breaker. I live here and manage a complex chronic condition, but it's part of the math, which is actually part of why I want to tell you about a great way to handle primary care here because the answer might not be what you expect. When I first moved to Tennessee, I asked a coworker for a doctor recommendation. He pointed me to someone who turned out to be one of my most favorite doctors that I've ever had, and then she moved to Florida. So I had to start all over. And what I landed on was something called direct primary care or DPC. I use a local clinic here called Community DPC, and it's changed how I think about primary care entirely. If you haven't heard about the model, it's really simple. You pay a monthly membership, mine is about $70 a month, and in exchange, you get essentially unlimited access to your primary care provider. No copays per visit, and the care feels completely different because of it. My nurse practitioner takes as much time as I actually need. The team there has been together long enough that it genuinely feels like a well oiled machine. And my provider is typically reachable by text, not just a patient portal message that gets answered in 2 or 3 days. Now, for retirees specifically, this model is worth understanding. If you're on Medicare, DPC doesn't replace it. You'd keep Medicare for hospitalizations, specialists, prescriptions, but DPC can become your primary care layer. And for a lot of people, that's where most of the day to day health needs actually live. The transferable principle here is that healthcare in a smaller region rewards being proactive about your setup. Finding a great primary care relationship, whatever model that looks like, before you need a specialist is how you avoid scrambling when something actually goes wrong. All right, I want to spend a little time on the VA section here because we have a significant number of veterans in this audience, and this is a question that I get regularly. The good news, Southeast Tennessee genuinely is well served for VA care. Here's what it actually looks like here. The Chattanooga VA Clinic, this is the most full service outpatient clinic in the region. It's part of the VA Tennessee Valley healthcare system and offers primary care, mental health, cardiology, physical therapy, audiology, radiology, and telehealth. Athens VA Clinic focuses on primary care, mental health, telehealth, and lab services. And if you're in McMinn or one of the nearby counties, this is going to be the closer option. It's a smaller clinic than Chattanooga, but it's there to serve you when you need it. Both clinics are part of the VA Tennessee Valley healthcare system, which also operates a full medical center in Murfreesboro and the main campus in Nashville for anything that's requiring hospitalizations or major procedures. Now, there's one more piece of the veteran puzzle in Cleveland specifically, and I think it deserves a mention. The Tennessee State Veterans Home in Cleveland on 28 acres in Bradley County is a 108-bed skilled nursing and long-term care facility for honorably discharged veterans. It opened in 2023, received an outstanding VA survey rating shortly after, and is now fully operational. There's currently a waiting list because demand has been strong, which is actually a great signal that the quality is there. This isn't an outpatient clinic, it's a long term and skilled nursing care facility. But for veterans that are thinking about what the later chapters of life could look like close to family in this region, it's a meaningful resource. There's also the Chattanooga Vet Center, separate from the VA clinic, which focuses specifically on combat veterans, MST survivors, and reintegration support. So if that applies to you or your family, it's worth knowing that it exists. Okay, here's what I want the veterans to take away from this section. That access point that matters most to you depends on where you land in the region. Chattanooga is going to give you the most services in one place, and Athens is going to give you proximity if you're in that corridor. And for primary care, between VA appointments, DPC, or a local clinic can really fill in the gaps in a way that makes the overall system feel a lot more manageable. And I want to share something personal because I think it illustrates the healthcare picture better than any list of facilities. Megan's parents moved to Southeast Tennessee as a retirement destination, a deliberate choice. And that decision created the conditions for something that mattered a great deal. As I mentioned in previous videos, Megan's grandmother had moved to this area to be closer to family. And were there healthcare challenges along the way? Yes. While the hospital here is improving quickly, it wasn't always the way that we'd hoped that it would be during that stretch. There were moments of frustration, but she had family nearby who could advocate, who could drive, who could be in the room, and that proximity, that ability to just show up mattered as much as any facility rating. I'm telling you this because healthcare and retirement isn't just about hospitals and clinics on a map. It's about how the full picture looks with the family nearby, the community around you, and yes, the facilities available when you need them. Southeast Tennessee has real healthcare infrastructure. It's honest, constantly improving, and it's part of a region where the quality of daily life is genuinely pretty awesome. Those things together are what make this place work. So let's recap what we've covered. Erlanger and CHI Memorial in Chattanooga are legitimate major medical systems, 30 to 45 minutes from most of this region. Bradley Medical Center in Cleveland is under a new not-for-profit ownership and trending in the right direction. Starr Regional in Athens serves the McMinn County area very well. The VA has real outpatient clinics in both Chattanooga and Athens, and direct primary care is a model that's worth exploring if you want a different kind of primary care relationship. The specialist access question is real. It takes a little bit more intentionality here than it does in a metro, but it's navigable. I'm living proof of that. If you want to dig deeper, the next episode in this series goes town by town and looks at which communities in Southeast Tennessee make the most sense specifically for retirees, factoring in all of this. Be sure to subscribe so that you don't miss that one. And this video right here is the first one in the series, and that's worth giving a watch. And if you're ready to talk through your specific situation, your health needs, your proximity questions, where you're coming from, and what you're looking for, I would love to have that conversation with you and learn how I can help you live your best life in Southeast Tennessee.